20 minutes to 8 o'clock on this Wednesday morning, and today is World Mental Health Day. Now, the University of Cape Town has done a study that shows African women, particularly mothers, are especially vulnerable to depression in South Africa. Now, their children, in turn, are also likely to become depressed. The study looks at how socioeconomics affects depression and its transmission. For more, we're joined in our Cape Town studio by Dr Katherine Eyal from the University of Cape Town. Doctor, good morning, and thanks for your time. I mean, how do we arrive at this conclusion that what tells us that it is mostly black women and particularly mothers who are vulnerable to depression?
So we have this wonderful new study which called the National Income Dynamics Survey, which is nationally representative and asks questions about depression. Now, you might say, okay, this sounds a little bit boring, but actually the last study which asked about mental health in South Africa was in 2002. So we have known nothing about depression in South Africa for everybody for a very long time. So essentially we've got the study. We have a wonderful set of questions which ask about depression in such a way that people don't know that they're being asked about depression, because stigma is huge, and we need to find out from people whether they are suffering from depression or not without letting them know that we're asking them about their mental health. So we used our study, we got the data, and we analyzed and we looked and we found for African women there were these shockingly high rates of depression. And in particular for mothers, we have 25% of the general adult population do suffer from depression. In African women, it's higher at about 30%. And for mothers, it can be shockingly high above 30%. And depending on where you are, even 40%.
And have we been able to determine why, though? Why is it that it is African women and particularly mothers? I mean, we know depression for mothers in general, regardless of race, if not picked up, can be quite serious. So what is it that makes this number so high? Why?
So unfortunately, it is essentially just related to income. We know that disproportionately low-income African women, very many of them will be low income, and there is a huge relationship between poverty and mental illness. Basically, if you are in poverty, your conditions lead you possibly to suffer from depression, and if you are depressed, that very often means that you can't find work, you have, it impacts on your abilities to find work, and thus that then goes to poverty. So it's this horrible, vicious cycle, basically.
And then when we look at their children and we say that, there's intergenerational transmission of depression from African mothers to their adolescent children, are we talking genetic? Are we talking about learned behavior? Are we just talking about being around somebody who, is in this state of mind? How does that happen, Doc?
So there are two things here. So the environmental and genetic, obviously that's our immediate thing. As academics, we jump in there and we say, this is really interesting. What is the story here? We know that genetics play a big role in mental health, but we also know the environment, the household, these shared factors that both the mothers and the children are subject to, they may play a role. So we did some investigation and we found that essentially the environment trumps everything in South Africa. Genetics are important, but your environment is massively important. If you can affect the environment positively, then you can really reduce the intergenerational transmission of depression hugely. And there's just one thing which is a fascinating result that we found, which is that if you go and you look at what is passing on depression, what affects it, nothing affects it, except for one thing that we found, which affects the intergenerational transmission of depression, which is the child support grant, which was the most amazing thing to find. Essentially, adolescents receiving the child support grant, if their parents are depressed, their probability of becoming depressed would be high, except if they're receiving the grant, that probability is halved. So it hugely reduces this chance that your mother will pass her depression along to you. So that was in terms of genetics versus environment. That was a really exciting result for the environmental part.
Certainly very interesting. Thank you very much for that explanation, Dr. Katherine Eyal from the University of Cape Town.